Today we'll be talking about high blood pressures, also known as hypertension, and discuss what do we mean by high blood pressures? What are the risk factors? How do we screen ourselves for having high blood pressures? What to do if our blood pressures are high and how to manage it? What can happen if our blood pressures are not controlled? Hypertension is a condition that puts us at risk of having heart attacks, strokes, kidney disease, and worsening of our eyesight, which can eventually lead to blindness if not controlled. Hypertension itself does not cause any symptoms usually, but it can be serious. Hypertension is either primary or secondary. We'll be talking about primary hypertension since the majority of patients have it. Secondary hypertension is diagnosed by doctors based on medical tests. Once a person has been diagnosed to have hypertension, he or she should follow up with their doctor to get further diagnosed whether they have primary or secondary hypertension. What causes primary hypertension? Primary hypertension was previously known as essential hypertension. The exact mechanism or pathogenesis is not very clear, which basically means that we don't know. However, it is believed that numerous environmental and genetic factors play into us developing this disease. When your doctor or nurse tells you your blood pressure, they will tell you two numbers. For instance, your doctor or nurse might say your blood pressures are 120 over 80. The top number, 120, is the pressure inside your blood vessels or arteries when the heart is contracting. The bottom number, 80, is the pressure inside your blood vessels known as arteries when your heart is relaxed. Elevated blood pressures is a term used by doctors and nurses as a warning. Elevated blood pressures do not mean that you have high blood pressure or hypertension, but it is not considered ideal blood pressures for good health. Many experts have defined normal, elevated, and high blood pressures as normal being top number 119 or less, bottom number 79 or less. Elevated blood pressures, top number between 120 and 129, the bottom number 79 or less. High blood pressure or hypertension is defined as top number 130 or above and or the bottom number 80 or above. Risk factors for developing hypertension are age. Incidence of high blood pressure increases with advancing age. Obesity, physical inactivity, excess of alcohol use. Genetic predisposition, which means it is twice as likely to develop hypertension if one or both parents are hypertensive. Excess of sodium intake, which is equal to more than 3 grams of sodium a day. Certain medications can also cause hypertension as a side effect. Please ask your doctor if you're on such medications. Some of these medications are oral contraceptives, antidepressants like selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, and tricyclic antidepressants. Also, glucocorticoids, prolonged use of NSAIDs for chronic pain, and certain other medications can also cause hypertension, including some decongestants. How to screen yourself for high blood pressure. To measure blood pressure at home, one needs a validated automated oscillometric device, which basically means a good blood pressure measuring device that can check blood pressure by itself once the button is pressed. Blood pressure should be measured in the upper arm. Before the blood pressure measurement is done, one should have emptied his bladder. He should avoid drinking caffeine, exercising, or smoking for at least 30 minutes before the measurement is taken. He should be seated in a quiet room, relaxed, with both arms and back supported, both feet on the ground, for at least 5 to 10 minutes. During this period, he should not talk also. After this, he should take his blood pressure measurement. Once the reading is taken, he should take similar readings for at least 7 days, both in the morning and evening. Every reading should be written down with date and time. He should take these readings to his doctor, and then depending on the readings, the doctor can diagnose whether he has high blood pressure or not.
If you liked the video, please subscribe, like and share.